Hi guys, this is the Bodyweight Coach and this is going to be a Bowen Therapy video. I've got my mum on the table, guys, and this is really cool for me. I haven't had mum on the table for ages, and for many reasons it's great because I really want to relieve some of the stress or try and help relieve some of the stress that she's been going through. She's moving, which is stressful for everyone, but you know, she's not so young anymore, so it's harder to handle stress the older you get. Now, the other thing that's been stressing her a lot is she's had a bit of memory loss lately, and it's gotten worse since she had a bit of a fall a couple of months ago. She fell backwards, fell on her head. She lives pretty far away from me, so I didn't get to treat her straight away. And since then, it's been a little bit worse, and she's been a bit foggy in her brain. Whether it's concussion, it could be that. So it's just not dramatic, so I don't want you guys to think it's, a dramatic issue here where it's really bad. But she's definitely suffering from memory loss. The doctors have said it's not dementia, but just sort of to highlight the issue that I'd like to try and help her with. So I'm only going to have the time to do one treatment. She's only with me very shortly, so I'm going to stay in touch with her to see how she's responded to it, if it's helped at all with that. Hopefully she can get some treatment while she's up there off someone else. But yeah, I'd really like to help her with what's going on with her right now. Now, there's no evidence, scientific studies around Bowen therapy helping with anything to do with memory loss, from what I've found anyway. But the stress associated with it is pretty dramatic. So that's probably been one of the hardest things for mum to deal with. Also, what's been happening is when she does get stressed, it tends to be worse. So she can be out somewhere, it can be really stressful. She can be out somewhere and then she'll get lost and then she gets really stressed. Or she won't know where she is. She'll forget what she's doing and then she gets stressed and it gets even worse. Or she'll be somewhere and she's unfamiliar with something, maybe getting a train somewhere and then having to do all the processes of getting a ticket and all, the new agey kind of things. You can't just go and pay someone for a ticket these days. You have to figure out this machine and that machine. And then the stress kind of gets worse. Or the stress makes it worse. Then she starts stressing and then she starts to, kind of forget and not know what's going on anymore. So stress could be related to this for sure. Bowen therapy is fantastic for stress relief, and that's what I'm going to try and sort of address as much as possible within this treatment. The other thing I want to address in this treatment is the wait time. Mum loves the wait time Bowen therapy, and she's been trained in Bowen therapy for a very long time ago. It was through mum that I got exposed to Bowen therapy, and she loves doing the wait time. She loves getting the wait time treatment. So it's a fantastic video to talk about the wait time. I'm also going to get mum to do a treatment on me after if she feels up for it. And so you can see how someone who's been doing wait time Bowen therapy for 30 years or so, how she works. But for now, I just want to say that this is going to be a very wait time focused Bowen therapy. How I use the wait time is based on my intuition and what the body kind of tells me. I don't have a 2-minute wait time rule where I'm watching the clock. I'll do some work. Sometimes it might be a minute. Sometimes it might be 3 minutes. Sometimes it might be 5 minutes. So I allow myself to be driven by that. Sometimes you can allow communication. Mum will often tell me that she's feeling some warmth and feeling some tingling, feeling some results straight after doing a move. And then she might say that to me and then I'll ask her, are you still feeling anything? And if it's stopped, I might move on and say however long that takes. So we'll get straight into the video, guys, enough chatter. And one other thing, I might not talk too much during this video. I really want to allow mum to relax and to switch off. I don't want to be here blabbing too much. And yeah, hope you enjoy the video. One other thing, Mum has got some shoulder issues going. She's got a tear in her shoulder. It needs surgery. So that's what they're telling her, that it needs surgery. She was sore the other night when she arrived here. I did some Bowen, and it's helped a lot. How are you feeling? Is it feeling a lot better?
Mm-hmm.
So it's feeling a lot better since then. She was she was very uncomfortable. So I'll also be thinking about that a bit during this treatment. Okay, give me some nice deep breaths. Now, I might say a few things because a lot of things are coming to my mind, and I'll just talk a bit quietly. I might turn the volume up, so excuse me if I'm mumbling a little bit. So, my mum comes from a yoga and meditation background. She's been doing that for as long as I can kind of remember. And so the reason that's kind of important, I feel, is because she's very comfortable being in her own space, breathing, switching off. And that's why very quickly was she drawn and comfortable with having Bowen therapy applied like this, where the complete opposite is a good example. My mother-in-law, she's never done any meditation or any relaxation or yoga or breathing. The first time she got Bowen therapy and she had the wait time, she was like, what's going on? Why, she got a move done, she'd put her head up and look around and go, what's going on? Why have you stopped? What am I supposed to do? Kind of thing. And so you can see the different type of people will respond differently on a mental level. And so the reason I'm sort of saying this stuff is because this is where working without the wait time can be very effective to help the person who is in their head, who has a hard time switching off and being in their body and being in their breath. You often don't know who that person's going to be, so you can talk to them about it, or you can pick it, or you can start off with out the wait time and then start to apply the wait time. But yeah, I just wanted to sort of mention that. Right? Yeah. RTB? Hammies? On this side? Or both? But which, when I did the move where? On the right?
You did it on my leg, I think.
No, I didn't touch your leg.
Oh, well then it must have been.
Oh, cool. How long were you felt? Were just literally just then or earlier?
Earlier.
Oh, okay. So Mum was just saying that she could feel some stuff here. So it felt like what I was working there.
Afterwards.
Okay. So yeah, she could just feel, some sensations around a distal area from where I was working. This happens all the time. This is also the beauty of applying the wait time and getting patients comfortable with the wait time. So that scenario that I was kind of talking about before with my mother-in-law, had she been explained in a bit of depth what right now it's a response time as opposed to a wait time, or not even being told. I don't think she was told. But getting your patients on board with your body's going to respond to this for potentially a week. We're just going to allow it to respond. They can think about, maybe you can say we're doing a bit of an adjustment now and your body's going to adjust to this. Explain to them they might feel sensations and to breathe and relax and observe what happens to the body. This is where the word I like to use is response time, because the wait time, I feel, can make someone a bit impatient, like it used to make me.
I feel it in my bottom.
In your bum? Okay. Now she's feeling it in her butt, just in case you can't hear her talking.
And the front of my left thigh.
And the front of her left thigh.
Like a twitching.
Okay, so she's having some twitching on the front. So I'll just let that respond for a while. Until, let me know when it stops, Mum.
It's all in my right side, going down to my toes.
What is it, the twitching?
No, like a pain thing going down my leg to my toes.
Okay, so she's feeling a bit of pain thing going all the way down to her toes. And anything can kind of come up like that and pass. Allow it to pass if things come up. Or if it stays, you can continue. I've had this where things come up and it's making someone uncomfortable, and then they'll often point to an area where they can feel the discomfort, and then you can work that area, do some moves on that area, help it move along. Still there?
Just up here now. Up in the right hip.
Okay. So we've only done these 3 sets of tiny, very subtle moves, and we've had a pretty strong response. So for those of you who haven't seen Bowen Therapy before, I hope to also make this video a bit of a demonstration for people who've never seen a Bowen Therapy treatment before or experienced one. So what you could do is work this area right now, but before I do that, I want to open the back a bit more, because often things from up here or things from further down can be coming from things further up, or vice versa.
did that again, and I came and the tingling in my feet.
Both feet? So now I'm going to do some work on the buttocks. That was gluteus minimus. So is this. Quite tight.
Yeah. It's going to my knee. A bit of pain.
This is gluteus maximus and gluteus medius. I'm going to do hamstrings.
That's hurting, you know, when you do that.
Hurting?
Yeah, it goes down only to my knee.
Mm. Mum's, all the times I've treated Mum, she's never had discomfort or mentioned any pain.
My knee.
Or just anywhere really. From while you were getting it. So this is long overdue. While I'm waiting for the response time, I'm often watching the body, see how it changes, watching the breath in particular. It's a very natural thing for me. I also, through Mum, have done a lot of meditation, breathing exercises. The martial art that I did was very heavily focused on breath. And then the other type of bodywork training I've done is almost based completely around breath work. So when I found out that Tom Bowen really focused on people's breath as well, I was really excited about that. So what you can look for with breath, I could do a whole video on breath, but while I'm letting this respond a bit more, you could, for one, see the regularity of the breath, pace of the breath, and then the positioning of where the breath is going. So you can see, if you can see this with Mum, she's breathing into her belly. So she's going up and down here, where a lot of people, most patients, I have to teach them how to breathe into their abdomen. Most people are shallow breathing into their lungs. But often with Bowen therapy, I like to just see what the treatment does, observe and watch it change their breathing pattern, watch it sink their breath into their body. It's quite fascinating. So without even kind of educating people sometimes, you can change and improve their breathing. Really tight up here. Here I was working the rhomboids just before, now working the upper traps. Here I'm going to do the levator scapula. And now, while that's responding, I'm going to do some work on the feet. So this is where, sometimes there's the challenge of, I feel there's a lot that needs to get done today. And if I get too stuck by the wait time, I'm not going to be able to address as many of the issues that I feel could be related to potentially what's going on further up. Could help her relax more. So feet are super important to me. They're incredible for relaxing and grounding someone, drawing the energy out, bringing them into their feet for one, purely on the relaxation front. Then with balancing the body out and making sure everything's in alignment. The feet, super crucial for making sure the whole body is in alignment, the whole skeletal structure. Whether it's the feet, the hips, or the jaw, those three areas to me are really important to balance out in a treatment to make sure everything's moving properly and in a nice balanced position. So yeah, if I waited for this whole treatment, I wouldn't be satisfied that I got everything done that I needed to, and I feel it might take too long. So I'm going to probably deviate from the wait time a bit. That's how I'm feeling. I'm comfortable with that. Again, if I didn't feel that, then I wouldn't do it as well, but I'm feeling that I can kind of move on now and work without the wait time so much. Here I'm just feeling the feet for tension and comparing both feet. Thumb's feet feel really good actually. If anything, I feel the toes are a bit locked up, so I'm just going to do a few moves for her toes. So what you kind of learn from this response time, or what I've learned from this response time, is that lots of different things that you do to the body as a body worker, you can apply that idea to. So here I'm wiggling the toes around, doing some side to side, up and down, and then doing a few circles in either direction. Now, at the time, while I'm working, it might not change the tension or the alignment or the movement, range of motion of those joints instantly, because I'm kind of in and out of there pretty quickly. But then again, you allow it to respond and come back a couple of minutes later and reassess, and you'll see that the majority of the times there's been a response. So it's not only with the Bowen move that you can get responses or work with that idea. You can do it in lots of other ways. So it's one of the really cool things about what you learn, or what I've learned as a Bowen therapist, or from the Bowen technique. I come from a massage background, and often the more you rub, you try and rub more to release more, where with Bowen, do a couple of moves, let it respond, come back, and all the work's been done for you a lot of the time. How's the pain in the back, in the butt? Gone? Okay. So what about this tingling in your feet?
It's gone.
So,
All I feel is heat in the front of my left thigh.
okay. In case you didn't hear that, all the discomfort in the buttock and the tingling in the legs and feet have gone. She's feeding in the front left, did you say?
Thigh.
Front left thigh is
Warm.
warm. Okay. So, just for those of you who don't know, while I wait, just another quick thing about the wait time. This got observed by Tom Bowen having lots of different rooms. So, had 5 rooms going at a time. Just moves on someone and go to the next person and work like that. My teacher, Robert, he had a treatment from Tom, and he went in. Tom said to him, "What's up, Hainsey?" Because he knew him. Robert's grandfather was friends with Tom Bowen. And he said, "I've got a bung knee." And Tom said, "Let me have a look at it, mate." Did a couple of moves in his knee, walked out of the room, went to another room, came back a couple of minutes later and goes, "You'll be right, mate," and sent him home. So this was an observation from how Tom was more driven to work as opposed to potentially having the time to work with just one person. So, it's a fantastic observation. We can really appreciate the wait time. I've since learnt from Robert that he prefers to work without the wait time because he can get to more issues within the same treatment. So more can be addressed. And he's been using the wait time for now, probably around he's been working without the wait time for the last 30 years or so. Not that he doesn't use it, he's the one that taught me to use it and based on how you feel, your intuition. Sometimes you'll just be like, I have to stop. And sometimes you'll be driven to just continue to work. So, yeah, I just wanted to add that while we're having some more response time now. Okay, and get Mum to roll over. Can you roll over?
Oh.
Go a bit over to your left.
Mm-hmm.
Go a bit over to your left. So I did a bit of neck work there, bit of TMJ work, or sort of focused around starting to work on the TMJ itself, but I did temporalis there. Very effective at releasing tension in the jaw from tension up in the head. You say Mum's really good at responding and relaxing and letting her face go. You probably can see that right now. Another thing that's happening is Mum's stomach is gurgling like crazy, and that's her parasympathetic nervous system kicking in. Mum's often in fight or flight. That's because she can never sit still. She can't. As much as good as she is at relaxing and tuning into her body and relaxing in these moments and calming her mind and all that, when it comes to real life time, she's... And the reason I know that is because I have that tendency, and I can, when I'm down, I can chill, but most of the time I'm, okay, I can do this faster. How can I do this faster? Everything I'm doing, I'm trying to do it as quickly as possible, in a bit of a stress situation like that fight or flight. It's just a natural tendency that we have. So if you can hear gurgling, that's her body just parasympathetic mode, relaxing. If you have that with your clients, it's really nice. It's a really welcoming sound for me. Just so in case you guys have that and you don't know what it is, it's the relaxation response. This is psoas release, guys. Super, super effective. Deep spinal muscle actually, but I was going to say abdominal muscle release, but abdominal area release as well as releasing psoas, which is a spinal muscle, but super subtle, super soft, but incredibly effective. Love that move. It's one of my favourites. If you could hear that, that's cool. There, I did masseter. Now I'm talking to the camera now. Did masseter and buccinator. Just working some of the tension in the jaw. Now as that responds, we'll do some work down here. tibialis anterior. Just did the quads before. Now as the stuff down the bottom responds, lower half of the body, I can go back up and work the upper body again, or the upper torso, or pecs. I'll do biceps, and then subscapularis. And the Bowen shoulder cup move. Now I'm going to do the TMJ move to finish off the treatment. I'm also going to do the last part of the respiratory procedure again, just the moves I did earlier down here. I like to finish on that to center a person. TMJ procedure is some of the moves that I've been doing all around the jaw. I'm going to finish off with the final move on the TMJ joint itself, and then finish on these grounding moves for me. As you can see, we've had a really relaxing response, even though I've been blabbing on the whole time and Mum's in front of the camera and she really doesn't like being in front of the camera. But yeah, very relaxing response. So that's been a great outcome. I'm going to do this last couple of procedures and then just let her respond and finish off that way. So thanks for watching the video. I hope it's helped you a little bit and opened your mind to Bowen therapy, and also made you think a little bit about the wait time or not the wait time, and you can maybe be less more open-minded to allowing yourself to work the way you're driven to work. That's kind of how Tom was working. He'd didn't really have a course that he was following. He didn't teach any courses. So yeah, thanks again, and I'll see you in the next video. Can you put your finger knuckle in your mouth, Mum? The TMJ. Okay, take it out. Wiggle it side to side. Wiggle your jaw. Yep, swallow. Let your jaw go now. Just going to give a bit of a tap on your jaw. Nice deep breath. And sink into the table. Heavy.
Asleep.
Mm-hmm.
This warm mattress smells so nice.
How you feeling?